Tell me what happened.
What happened? Wow. Roughly about a little over a month ago, I got to a point where I really couldn't breathe. I couldn't get any oxygen whatsoever. I felt terrible. It just felt like somebody had grabbed my chest and my lungs and was just hanging on to them and wouldn't let me breathe. So I got an opportunity to come over here, and things changed. I started taking some treatments immediately. It took me probably about 3 or 4 days for it to really kick in. But after that, I could see and feel things getting much better. It was still a struggle. The first week and a half to maybe 2 weeks was a struggle. It was a lot of work trying to get the labored breath to a point where I could breathe more normal. But I got to a point where I felt really comfortable. And coming here, the atmosphere is awesome. So that helps out a lot. When you have people that you can see talking to you and you know, speaking like, oh, okay, we can take care of that. We can take care of that. It makes a big difference. Because when you come here, you don't know what to expect. And when you have, especially breathing, when you can't get air, you feel panicky. The hardest thing to do is to stay calm. But when you have staff that sits there and looks calm, acts calm, and they're very professional, it's easy to remain calm. And that helped me out tremendously. I've been through several life events, and this was probably the worst out of all of them. I know that sounds crazy because 2 of those were heart attacks, big ones, but this one really was something that I really was very concerned about. And here I am, almost a month later.
Remember how low your oxygen level went?
Yep, I sure
did
do.
it go?
When I came in here the first day, it was at 68.
And with the VA, didn't you try to get help there? Or I can't remember.
Yeah, let me tell you, the VA, oh my God. I love the fact that I don't have to go out and pay for medical with regards to the VA. However, they have a very structured protocol. And their structure was very simple. You can't breathe, you go to the hospital. I said, but I don't need to go to the hospital. Nope, that's not what we have here. It says here on the computer, if you can't breathe, you go to the hospital. And I'm telling you right now, I know what would have happened. The next protocol would have been going in directly into emergency, from there being placed in some kind of little cubicle, and then from there being isolated all the way to ICU. I know that because that's their protocol. How do I know that? With many years experience with the VA, I know how they seem to be more concerned with what the diagnosis is and what the computer tells them to do than listening to you. So I couldn't do that. I had to find an alternative. And luckily I did find an alternative.